Today's session of YouTube. Just was discussing one of the case of a very interesting case was there. So if everybody comes on, I'll just discuss that case. Give me some water, money. Now this was a case basically where the patient came to me for vertigo, and she had a lot of vertigo problem, a lot of vertigo. Well, moving up vertigo, while looking down vertigo, sideways vertigo. And this has been since long time. So we were just taking the case, and she said that she has taken a lot of treatment. There was no result. And the typical symptom was that she had vertigo, and there was a lot of vomiting with vertigo. And when we traced the history, that vertigo was for the past 2 years, that after the first delivery. So if you basically try to repertorize this case, then we took only two symptoms for repertorization. One was vertigo with vomiting, and second vertigo after parturition. The only remedy that comes to that repertory chart is ferrum metallicum. So ferrum metallicum 1 ml was given single dose, and the patient came after a week with very positive results. The intensity, the frequency of vertigo reduced to at least 70 to 80%, and she was very happy with the treatment. So in cases where there are a lot of modalities, sometimes there are so many modalities, so many permutation combinations in a case. If you take vertigo from looking up, from looking down, from looking sideways, from moving, every modality is there. But still, if you take those modalities, sometimes what happens that you get confused. So take a modality which is very unique, which is very particular to the case. That's why we took this symptom, and the ferrum metallicum gave us very good results. Within a week, 70 to 80% was better. Now, as we look upon ferrum metallicum, now it is a very, very interesting remedy. Now what we know about ferrum metallicum was that the patient is very like metal quality and very strong and stubborn nature. But there is other side of ferrum metallicum. A ferrum metallicum patient is easily excited. It is not always that easily excited means he gets angry very easily. Excited very easily means he is very sensitive, sometimes hypersensitive or oversensitive to a lot of external stimuli like phosphorus, like naxomica, like kalika. This is a very important symptom of ferrum metallicum. Like the patient also had easy vertigo from looking up, from looking down, from looking sideways, from looking here, looking there. That was ferrum metallicum. So we say it is a person of sanguine temperament, very quarrelsome, very disputive, easily excited. Least contradiction angers the patient. Least contradiction. Very similar to ignitia ambra, very similar to anacardium. And amelioration from mental exertion. This is a very important modality of ferrum metallicum. That is amelioration from mental exertion. You'll be surprised that when a patient comes to you and he has headache or he has migraine, he has vertigo, he has XYZ disease, and he says that whenever I am working, if he's a chartered accountant or he is working in office, whenever he is working in his office, whenever he is in his work, all the symptoms are better. That is ferrum metallicum for me. This is a very, very important indication of ferrum metallicum. And you will see this in lot many of complaints. And don't always think that thinking aggravates the complaint, that symptom. In fact, amelioration from mental exertion is supposed to be the most important symptom I have seen in my practice of ferrum metallicum. Of course, then he has irritability, like slightest noise, like crackling of paper drives him to despair, like SRM euphorbium. Those are there. But this amelioration from mental exertion is a very, very important symptom of ferrum metallicum. So this is this case which I wanted to discuss about ferrum metallicum. So I welcome Dr. Ritu, Dr. Babel, and just Smiths, Dr. Patel, Dr. Ved Prakash Singh. So this was an interesting case. Today just the patient came with follow-up and she was much better. That's why I wanted to discuss the case. Of course, if you see ferrum metallicum, classical vertigo symptom, it is written in a Materia that vertigo with balancing sensation, as if he's on water. He must lie down with aversion to eating or drinking. This is ferrum metallicum exactly about vertigo. So we move on to one of the questions, that is, sir, persons having lymphadenopathy under jaw in salivary gland region for years. Node is hard but movable, painless, person gets hardly cold and fever as his immunity is strong. Weight loss is normal. So whenever you have cases of lymphadenopathy, remember one thing. If you are basically prescribing only for glands, then it is possible that you land up in particular drugs. For example, in homeopathy, it is so easy that if the glands are maybe hard, so there are sets of remedy which are so easy to understand, which are so easy to prescribe. Like uh, we have a very interesting remedy where the glands are very hard. You can think about calcarea floor. You can think about phytolacca. You can think about conium. And see, there are lots and lots of remedies. But if the case has become chronic and it has been since years and now it is not disturbing the patient, that means the constitution has adopted that change in the patient, and now the constitution has matured and it is not giving any problem to the patient. In this case, if you prescribe only on this gland symptom or hard glands, you land up in a remedy which will not cure the case, which will not cure the case, it will only palliate. For example, there are remedies like calcarea floor is there, carboanimalis is there, conium maculatum is there, kali muraticum is there, bryonia is there, lycopodium is there. But in this case, if the constitution has adapted to that change, do think about a constitutional remedy. That is very important for you. I'll give just an example. Like for example, if you think about carboanimalis. Now, carboanimalis basically, if you think, then you have to think which are glands indurated, swollen in the neck, in the axilla, in the groins. But the problem is it is painful. That is what is in carboanimalis. If you go still further, and you see remedies like phytolacca. Now, phytolacca also is a remedy for glands complaints, but in this, you see that the glands often are painful. But if you're looking at conium maculatum, now this remedy will suit your case because it is written stony hardness. Glandular indurations of stony hardness, mammary glands, testes, or any cancerous deposits. But it is after bruises or any injury of the gland. So in your case, it is now, since a chronic case, the body has adopted, do take a case taking and then try to prescribe rather than only prescribing for glands, because you'll land up in only 5-6 remedies that may or may not give a change to the patient. I hope you understand that. Mishraji, good afternoon. So this is what is my answer to Dr. Chatterjee. I hope you understood that, because it's very important to understand what to take and how to go about the case taking to prescribe. That is so important. Next question. Now, see, in glands, if we have time, there are remedies where you can say that the glands are stony hard. Like you can think about remedies like sister scan. In these cases also, for example, there are remedies where the glands are knotted, beaded like, very hard, small glands type. In this, you have to think one of the iodes, either calcarea iode, either sulfur iode, or you can think of remedy like brata iode. Now, these remedies basically also have some remedies, some symptoms regarding the glands. For example, if you have seen, we will take a very simple remedy, calcarea iode. Now, if you have seen calcarea iode, it's a very, very important remedy for glands. But again, calcarea iode is a remedy where the glands are filled with mucus, filled with some what you call fluid. That is the gland of calcarea iode. That's why calcarea iode is a very, very important remedy for enlargement of thyroid. What time? That is important. Enlargement of thyroid at the time of puberty. In which type of children? Flabby children who are subject to cold, recurrent cough and cold. Hence, it is also an important remedy for adenoids. So this is something about calcarea iode that you have to remember, where the glands are knotted. In the same way, now see, if you go by textbooks, there will be a lot of remedies and we can discuss at length. But these basically are remedies where you have to look about the classical symptom of that remedy. And in your case, if for example, if I go forward and see tell you something about sulfur iode. Now again, sulfur iode is a very interesting remedy. Of course, if it contains sulfur, that means it's a remedy for all chronic complaints. But if you see sulfur iode, it's a very important remedy basically for skin affections. But as we have asked gland, it is a very important remedy for painless enlargement of glands with infiltration of tissues. Because of that, there is thickening and induration after inflammation. What will the patient say? I had recurrent problem, I had recurrent pain in the gland, and I have to take a lot of medicine. When I take the antibiotic, the gland goes. I take the antibiotic, the gland is gone. But now, for some time, this gland is not going. It is like this only. So after recurrent inflammation, there is induration and thickness, and the gland is painless. Then the remedy becomes sulfur iode. I hope you understood something about the glands. So this is so important. Okay. Now we can move forward to some other question. I hope Dr. Chaudhary, you understood something about the glands, because these are very common problems, and I always say that take the case because it has become the part of the body. Okay, so you can think about remedies like calcium iode, sulfur iode, brata iode, tuberculinum. These are remedies which are very, very important. Now, there are some cases where there is enlargement of gland which are painful. Then you have to think about mercator rubrum and stephysagria. So as you go further in your practice, you'll come to another lot of remedies. So good afternoon, Dr. Asrani. Can we have some more questions? Or you can type the question again, because it has, I think, scrolled up, because I have taken a lot of time giving the answer of glands. I hope you understand something about the glands. So we move forward. Some other questions. Okay, so as we go forward, and if there are no questions, I can always answer few questions more. Now, if you have seen remedies like I've told something about calcarea fluor, calcarea iode, phytolica, sulfur iode, brata iode, tuberculinum. Spongia is also there, spongia. If you have read I think I've put up a case. So okay, we'll talk about bromium. Did you read my OPD diaries, the case of bromium? Anybody? Have you read the case of bromium in my OPD diary? I had a case of, I think, recurrent cough, and the patient also had goiter. But the patient was not interested in treating the goiter. He was more interested in treating that cough and cold because it was very severe and very chronic. When we prescribed bromium to the patient, not only his cough and cold was cured, but also the goiter went off with bromium. So this is, I always say that whenever an acute disease comes to you, it is basically coming to tell you that the body is still not found the similimum. So try to evaluate and take that case in detail, so that you not only treat that acute complaint, but also the chronicity of the complaints, or the chronic complaints also get cured with bromium. Has anybody read about bromium? What I have posted in the... has anybody read about that bromium? Anybody? मिश्रा जी, आपने ब्रोमियम पढ़ा है? ब्रोमियम पढ़ रही है, बिकॉज ये बहुत क्वेश्चंस तो हम आंसर कर देंगे आपके, बट ब्रोमियम पढ़ा है कि हम पूछ रहे हैं. इफ यू हैव रेड ब्रोमियम, it's a very interesting case, it's a fantastic case. And see, OPD diaries, whatever I write in that case, see, cases are very long, pages and pages. So that, but I basically take out the important points on how did I prescribe and what did I see in that patient. So it is a bit short. So it's a learning process, how a chronic remedy, which has some unique symptom, but we miss out because we have not thought of that symptom in that chronic remedy. Because we know only the symptoms which are very common to that polycrest, and we always think about that angle and forget that part of that unique characteristics of that remedy. That's what I wanted to share with you and share with my students and the doctors about the OPD diaries. I hope you have read the case of bromium. Do read the case of bromium. And if you have seen the case of bromium, bromium may... okay, if you have questions, so I'll not go forward. मिश्रा जी पूछते हैं, प्लीज टेल अस समथिंग अबाउट follicular. Yeah, only one person has read something about bromium, Dr. Weber. So please do read about that, because see what happens that whenever I'm writing a case, it normally takes a lot of time writing a case and then explaining. So मिश्रा जी ने एक सवाल पूछा है, follicular pharyngitis. अब सी फेरेंजाइटिस लेके आपको ट्रीट करना है मिश्रा जी उसको, मतलब फॉलिकुलर है, टॉन्सिलर है, कि वो इस पे दिमाग अपने को दौड़ाना नहीं है. हमको ये देखना है कि टॉन्सिलाइटिस के सिम्टम्स क्या है. फॉर एग्जाम्पल, कभी कभी कोई पेशेंट हमारे पास आता है और बोलता है कि डॉक्टर साहब मुझे बहुत ज्यादा पेन है यहाँ पे, और ये टॉन्सिल्स जो है ना बहुत सालों से, मेरे को बहुत सालों से टॉन्सिल्स है. तो उसके बारे में अगर बहुत क्रॉनिक केस हो गया मिश्रा जी, उसके बारे में आप सोच सकते हैं हिपार सल्फ, उसके बारे में सोचिए आप सल्फर आयोड, सोचिए थूजा और ब्राटाकार. बट पेशेंट सिंपल टॉन्सिलाइटिस बोल रहा है और आपको सिर्फ सिम्टम देख के आपको दवाई देना है, टॉन्सिल्स बहुत बड़े हुए हैं, लाल लाल दिख रहे हैं वहां पे, ब्राटाकार, कैलकेरिया फ्लोर, कैलकेरिया आयोड एंड कैलकेरिया फॉस एंड ट्यूबरकुलिनम, ये 4-5 रेमेडी बहुत ज्यादा इंपॉर्टेंट है. कभी कभी कोई पेशेंट क्या बोलता है कि मेरे टॉन्सिल्स के अंदर से जब खास बहुत बास आती है, मतलब पस जमना शुरू हो गया, उस दौरान आपको सोचना है हिपरसल्फ, सिलिशिया एंड मर्कसॉल. सो ये सब कॉमन रेमेडीज है. और सिंपल टॉन्सिलाइटिस है, आपको सिर्फ पेन है, इन्फ्लेमेशन है, आप सोचिए बेलेडोना के बारे में, लैक्सिस के बारे में, मर्काइडोरूब्रम, मर्काइडोफ्लेवर्स, नाइट्रिक एसिड, फाइटोलिका, ऐसे बहुत सारी दवाई है. सो डिपेंड सिम्टम के ऊपर करता है कि वो सिम्टम फिर कहाँ पे है, किस प्रकार का पेन है, क्या इंपॉर्टेंट है वो. सो डॉक्टर वेबर सेज द केस इज वेरी इंटरेस्टिंग. या आई ओनली पुट सम इंटरेस्टिंग केसेस, यू नो. यस, कैरेट डिजायर्स टू बी फास्ट इम्प्रूवमेंट, बराबर है. और एक क्वेश्चन डॉक्टर आलम से है, मुझे ब्लीडिंग गम्स की प्रॉब्लम हो गई है, गम स्वेलिंग भी है, स्नीजिंग से ब्लड आता है. और आप देखिए आलम जी कि ब्लीडिंग किस प्रकार का रहता है, ये बहुत जरूरी है. ब्लीडिंग इजीली आता है, ब्लीडिंग टच करने पे आता है, ब्लीडिंग का कलर कैसा है, रेडिश है, मरून है, ब्लैक है, उस पर डिपेंड करता है आपको कौन सी दवा लगेगी. बिकॉज क्या होता है होम्योपैथी के अंदर ये इंपॉर्टेंट है कि ब्लीडिंग किस प्रकार का जानना बहुत जरूरी है. फिर भी अगर आपने पूछा है मेरे को, तो मैं आपको बताता हूँ कि अगर आपको बहुत ज़्यादा ब्लीडिंग हो रही है और ब्लीडिंग रुक नहीं रही है, आपको कुछ रेमेडीज के बारे में सोचना चाहिए. वो रेमेडी लिख लीजिए आप. सबसे पहली बात रेमेडी है फॉस्फोरस, सेकेंड है मिलीफोलियम, थर्ड है लैकेसिस, फोर्थ है नाइट्रिक एसिड और फिफ्थ है क्रोटालिस हॉरिडिस. ये रेमेडीज है. बट अभी मैं आपको करके बताता हूँ कि पेशेंट बोलता है कि थोड़ा भी हाथ लगाता है ब्लड निकल जाता है, सो उसको हम लेते हैं ब्लीडिंग वेरी इजीली. जब बहुत इजीली ब्लीड करता है तो आपको सोचना पड़ेगा हिपारसल्फ, लैकेसिस, क्रियोसोट, नाइट्रोम्यूर एंड क्रोटालिस हॉरिडिस. पेशेंट बोलता है ब्लीडिंग होती है और ब्लड थोड़ा काला काला निकलता है, उसके टाइम आपको सोचना है आर्सेनिक, बोविस्टा, ग्रेफाइटिस एंड क्रियोसोट. और इसी प्रकार से आपको हर एक रेमेडी के बारे में सोचना है कि ब्लीडिंग किस प्रकार का है. ये रेमेडीज आपको एक आधी सूट कर जाएंगी. Treatment for tinea cruris when there is lot of itching and burning, aggravation and cold, apply emulsion, worms bed in. Yeah, so tinea आपको हमने बताया है डॉक्टर अंसारी. Do think about, see lot of remedies are there. Do think about tellurium, do think about natramur, do think about Azadirachta indica, do think about phosphorus. And if you are not able to get the remedy, make sure that I have used Kali Sulf 6-egg biochemic tablets. That also will give you good results. डॉक्टर अंसारी लिख लीजिए आप, काली सल्फ 6x बायोकेमिक टैबलेट्स या पाउडर देंगे आप, उससे भी बहुत अच्छा असर पड़ता है टीनिया क्रूज पे. आप देख के देखिए, आपको डेफिनेटली फर्क पड़ेगा. डॉक्टर स्नेहा गुड आफ्टरनून. डॉक्टर बावलिया, राज यूसुफ सर प्लीज के तुरंत बाद पायस लगती है सर, पेशाब के तुरंत बाद प्यास लगती है. नो सी ऑफ कोर्स इफ द पेशेंट इज थर्स्टी, सी ठीक है, हम दवाई तो आपको बता देंगे यूसुफ जी, दवाई बता देंगे आपको देन. बट क्या होता है कि बहुत ही अगर आपको लग रहा है कि बहुत ही क्लासिकल है कि पेशेंट को यूरिन करने गया उसके बाद थर्स्ट लगती है, so you can think about some remedies. But then for me, if you ask that, this symptom, it will only work partially, but I'll tell you the symptom. The remedies Veratrum, phosphoric acid, causticum, and antimtart. These are remedies which have this symptom. And one rare remedy which I'm not getting the remedies, I think it is castoreum, CASTOREUM, castoreum. Carried desires to be Brom Barabar. Dr. Navjot, good afternoon. Yeah. So I hope नहीं मतलब क्या. Yeah, so Kali Sulf try करके देखिए Dr. Ansari. Kali Sulf 6x also, Telluromane, Natriumurate, Azotate, Indica. These are very interesting remedies. Okay. Peaches की medicine means diarrhea, dysentery. There are a lot of remedies, फिर आपको देखना पड़ेगा कि भाई जो डायरिया डिसेंट्री हो रहा है वो किस प्रकार का है, कि भाई बहुत वाटरी स्टूल्स है, ऑफेंसिव स्टूल्स है, एक ही शॉट में आता है, बार बार जाना पड़ता है, बास आती है, किस प्रकार से, बहुत सारे इसके अंदर सिम्टम रहते हैं. बट जब भी हम डायरिया की बात करते हैं, डिसेंट्री की बात करते हैं, यू मस्ट थिंक अबाउट आर्सेनिक एल्बम इज देयर, क्रोटोंटिक इज देयर, नाइट्रिक एसिड इज देयर. There are a lot of medicine. In fact, if in summers अगर बहुत ज़्यादा आपको पेचिस लग गया, डायरिया डिसेंट्री है, तो एक बहुत रेयर रेमेडी जो आपको हमेशा सोचना चाहिए, दैट इज इगिल मार्मिलोस. इगिल मार्मिलोस इज अ वेरी इंटरेस्टिंग रेमेडी व्हेन देयर डायरिया डिसेंट्री या पेचिस धूप के मौसम में रहती. नाइट्रोमोस सोच सकते हैं, ग्लूमाइन सोच सकते हैं, बट इगिल मार्मिलोस बहुत अच्छी रेमेडी है. एंड चपारो भी और कुर्ची भी है. Yasmin says, how to approach a case of alopecia areata. See, alopecia areata, very, very important, Dr. Yasmin, a good question. And why a good question? Because, whenever the students who have joined me in my practice and a case of alopecia comes, so they are very sure. They tell me the remedy, sir, it is phosphorus, or it is vinca minor, or it is phosphoric acid, or it is fluoric acid, or it is kali carb, depending on the symptom, or it is like kali sulf, depending on the symptom. But I always tell my alopecia areata is a constitutional problem. The constitution is throwing out symptom in this form, like falling of hairs and patches. So it is very important for you to go with the whole case taking rather than prescribing some very, very, what you call, specific medicines, like which I told you, like vinca minor or phosphorus or kali sulf or fluoric acid or acid phos. These are remedies which may work or which may not work. But a constitutional remedy, especially, it is said that alopecia areata is because of a lot of stress. Then you have one more question, that alopecia areata is sometimes very common in children's. But that also is because of stress. In this competitive world, in this world, there is a lot of element of stress. So do ask that symptom of stress to get the perfect cure for alopecia areata. Medicines for severe constipation from childhood since age 34, desire for stools. See, whenever there is desire for if ये आलम भाई अगर बहुत सालों से अगर तकलीफ है कॉन्स्टिपेशन की और ठीक नहीं हो रहा है, मतलब पेशेंट को अक्यूट रेमेडीज काम नहीं करेंगी, बट फिर भी होम्योपैथी में कुछ बहुत अच्छी अक्यूट दवाई है जो हम कॉन्स्टिपेशन में दे सकते हैं. सबसे पहले दवाई आपको सोचना चाहिए सेना. उन्हीं पहले के ज़माने में सेना पत्ती भी हम देते थे. सेना पत्ती, Senna is there, Carlsbad is the medicine, opium is there, alumina is there, kali carb is there, bryonia is there, laccan is there, lac defloratum is there. Lot of remedies depending on the symptoms. Thank you, Dr. Yasmin. Dr. Meenal, hello. Sir, is sinusitis caused bleeding gums? Chances are very less. Sinusitis may cause bleeding from the nose because the sinus will be full, and it may cause that bleeding from the nose, or if the sinus are full, everything is choked and packed, so it may cause definitely bleeding from the nose. If you have cataract, if it is age-related cataract, then we can't do much. But if it is cataract which is very early in the age, it is a psychosyphilitic miasm, then do take the whole case before going for surgery. That's important, Female patient has hysterectomy and ovectomy. Since then, patient comes of knee pain with osteoporosis, soles burn, skin dryness. Yeah, so this is a very, very interesting question, a very, very common question, and it is very, very important to understand that after this operation, after the operation, why the patient suffered from. So whenever this comes to when you are, if you have removed the ovaries, you have removed the uterus, there is a lot of hormonal imbalance in the body. Very much hormonal imbalance in the body. That means if you are trying to give remedies like phosphorus or night or stephysagria or leaden pal or calicarbinol or stephysagria, sometimes it may work, sometimes it may not work, because the whole hormonal cycle of the body has been disturbed by these operations. In this case, make sure, first of all, make sure why did the patient had to go for uterus removal and ovary removal. Where are the fibroids? Then start your case taking from there. Why did the fibroid come in that patient? Why did the fibroid occur and at what age? So the hormonal imbalance, basically, it's the whole constitution has been affected. So it is very important to understand and take the whole case rather than just giving the patient some tonics and calcium. It will only affect the patient till the patient takes the medicine, and again it will come back. So a good case taking is very important, Dr. Abhijit Manda. A very good question and interesting question. Carbolic acid case rubric in which repertory? The rubric is in complete repertory. But sometimes what happens, that I also have cured some cases where I have not taken rubric. It is only through Materia Medica. And lately I have been teaching Materia Medica to the third year students. It's a batch. I started teaching the third year students, and gradually after the second lecture, the final year students are also coming. The interns are also sitting in the lecture, and the faculty is also sitting in my lecture. So sometimes what happens, that whatever I have seen in my practice, I want to communicate to all the doctors and the practitioners, so that something away from the book which I have seen in practice, so that it helps in your practice also. So sometimes I might tell you symptoms or cases which are sometimes not present in the books. It's only the Materia Medica part. So that also you have to understand, that I have now experience of 25 years of practice. But the carbolic acid which which basically you are asking me, I think it was today posted by my doctors, and it is from the complete repertory. Medicines for beta thalassemia. Yeah, for beta thalassemia, Dr. Katwar, I have also a lot of cases of beta thalassemia, and if you open the repertory, the remedies of like carcinosin is there. In beta thalassemia, one thing is very important. First of all, you have to understand from which part, from the dominant gene or recessive gene, from the father mother, because he has bought that from the genetic code what he has inherited from his parents. So the history during pregnancy is very, very important. I have lots of cases, and I will tell you that I have not cured those cases. The blood transfusion which was once in 10 days, once in 15 days, I was able to prolong that, maybe once a month, once in 6 weeks and all. But till date, I have not been able to cure those cases of thalassemia. But definitely the blood transfusion period has been extended. Though there are some cases where that is also not possible, and I can only say that the patient is feeling much better, very energetic, looks very good, but still a transfusion had to be taken. In all the cases, what I have seen in the practice, I have taken history of the family during the pregnancy, and the environment of the mother during the pregnancy, his relationship with the in-laws, with the husband, and that has led me to prescribe these remedies. Of course, in those cases of thalassemia or beta thalassemia or sickle cell and all, I have used LM potency in repetition, which has definitely given me very good results. Patient having amenorrhea for 3 months with blurred vision and vertigo when she raises from the bed. Very nice question, and very nice symptom you have taken, Dr. Navjot. Now, whenever the patient raises from the bed and he has vertigo and he has menses problem, so if you club everything, Dr. Navjot, there are 3 remedies which will come to a repertory chart. If I can remember those remedies, the first would be bryonia, second is phosphorus, and third is naxomica. These are the 3 remedies that you should think about. Of course, there will be remedies like, I think China would be there, and carbo veg also would be there in your symptom, because vertigo from raising in the waking up in the morning or any time with blurred vision, So think about bryonia, think about phosphorus, think about naxomica, the first part, the 3 grid remedies, and the 1 grid remedy which I have used is China and carboveg. 2 years old girl child, just a minute. Yeah, 2 years old girl child having bleeding problem from nose during sleep at night. Her father also had the same problem. Wow. So it is China. That's why I told you, Dr. Najot, China is the second grade remedy which I would take. That's why I told you China and carboveg, the last part. The first part is phosphorus. The first part is bryonia, phosphorus, and naxomic. Okay. What is the question? Bleeding. Yeah. So a very interesting question. Very, very interesting question that he has epistaxis and the father has that same problem. So if I was there, I would have taken the rubric where the patient was very close to the father, and if you match the father's symptom and those symptoms which are very common to both of them, and then the symptom which he has or nature which is basically not related to the father and it is only related to the child, and that would be the remedy of the patient. But you have asked me a very specific question, so I'll ask you a very specific remedies also. So her question is a very interesting question, and you have to be very lucky to get these type of cases also. That's why I always tell. So Dr. Sneha Aware, you can write down the remedies. The first remedy that you should think about, epistaxis or bleeding from the nose during sleep, write down in your Materia Medica. Merck Sol is the first remedy. Second, think about bryonia. Third, think about nitric acid. Fourth, think about naxomica. And fifth, think about veratrum alb. These are the 4 fire remedies that you have to think about whenever there is bleeding during sleep. Dr. George sir, watch your YouTube live on LM potency but need more explanation. Can you take one more session of LM potency? Yeah. Actually, one of my assistant also, a few doctors also have written me on the WhatsApp group, and they wanted me to take a Google Meet on LM potency, which I had told before also. So we are thinking of doing a Google Meet for LM potency, because LM potency is written in the 6th edition of Organon, and there is a lot of debate on whether we should use it or we should not use it, and how that LM potency came into existence, and does LM potency work, and how it has to be used in practice, and where it is written in the Organon, and what Hahnemann sir has said about LM potency. It's a very interesting topic, and I think which I had presented LM potency for me. I have presented it beautifully. I was feeling so happy from inside that I presented LM potency in one of my YouTube live. I took 2 or 3 YouTube live for LM potency. I was very happy. Sometimes you also feel very nice when you're talking about homeopathy, and I feel I had presented a very beautiful LM potency lecture. Though I think a lot of people wanted it second time also, because they wanted me to explain more something, because everything is written in books, but explanations is very important. So yes, Dr. George, we are thinking about that, and my assistants basically are now working a lot of time. We are working on case taking. We have new patients. We have a lot of follow-ups, and this now social media has taken a lot of time. We have to present cases and seminars. In fact, I've been going for seminars for the past 2 months, and I've been called in various colleges. So basically, I'm going now live, offline, you say. And it is very interesting that this social media has given me a good platform, and people are knowing me also. So I'm very happy, I hope I can take that LM potency in one of the Google Meet. I'll definitely ask my assistants what are basically they looking about. I'll definitely try and do that, Dr. George. So Dr. Sin China was given. Thanks, Dr. Anwari Sneha. Do you rub the until 3 or C3 or C4? Do you rub the potency until C3 or C3? LM potency basically, I just call from the market. So whatever is written, the way of manufacturing, I don't manufacture that. So I call from outside, Some potencies I make so that my brother makes for me. But I think the starting of LM potency is 3C. Patient having obstinate hypertension, which is hereditary, same with father and brother, Even taken allopathy, no change and can be homeopathy level 180, 110. Oh, so Dr. Navjot, in fact, you have given the answer in your question only, obstinate cases, very stubborn, obstinate personalities. That's why the blood pressure is also being very obstinately. Now, can you tell me which remedies are very obstinate? Okay, there are a lot of remedies which are obstinate, but what remedy comes to your mind in patients who are very obstinate, in the diseases which are very obstinate and it does not give results in spite of taking allopathy, antihypertensive medicines or anti-diabetic medicines? Can you tell me, anybody tell me, the important remedies which are very, very obstinate? Anybody? Important remedies which are very, very obstinate. At least tell me one or two. Anybody? So that you have to think about in case of blood pressure. So in homeopathy, approach to a case depends upon your case taking and what is your level of thinking. Simple, the patient is telling you obstinate, so we have answers ignitia, we have silicia, we have नक्सोमिका, but I want that core obstinate person. बहुत ही, हम हिंदी में बोलते ना, डॉक्टर मिश्रा जी, दिशा जी, बहुत ही हेकड़ आदमी, मेरी मुर्गी की एक टांग, बस मैं जो बोला वही है, वेरी ऑब्स्टिनेट, वेरी स्टबर्न, caustic. No. So we are talking about remedies which are very obstinate, and there are 3-4 remedies which are so obstinate. You have to think about first Naxomica, Anacardium, Chamomilla, Tarantula, Opium, Belladonna, and seventh remedy that everybody should remember, because nobody ever thinks that this remedy is obstinate. You can never think that this remedy is obstinate. Can anybody give me the answer of which remedy I'm talking about? I have told you the most obstinate remedies: Anacardium, Naxomica, Belladonna, Chamomilla, Tarantula, Alumina. One more remedy which is so obstinate, but we never think that the remedy is obstinate. That's why we do not prescribe that remedy. That's why in OPD diaries, what I am trying to point out, you look at my look at my thinking, what I want to tell you. I want to tell you something about those remedies in my OPD diaries where I have found some symptoms so useful in that remedy, but we have not read it because we have been prejudiced that this remedy has this theme, this remedy is working in this way only. Yes, that remedy is calcarea carb. Calcarea carb also is very much obstinate, like Naxomica, like Anacardium, like Belladonna, like Chamomilla, like Alumina, and like Tarantula also. It is so obstinate. The main motto of me writing OPD diaries is this: to widen your vision about the polycrest remedies, which has so many symptoms hidden in that, which we never look because our mind is prejudiced. Calcarea carb is this symptom only. Calcarea carb is timid, want support. So we never think about that remedies. See the importance of OPD diaries. So I've put all my experience of 25 years in writing these OPD diaries. I thank my assistant doctors, my juniors who are with me. They are taking an effort to write. Okay, so I'm talking about calcarea carb. Of course, plumbum is there, sulfur is there. I'm not denying that. But whatever that core obstinacy I'm telling you, I have told you about that. See there, if you look at the Materia Medica or Repertory, there are about 100 to 120 remedies which are obstinate. You can have a lot of remedies, but I am telling the core. In fact, if you have now, Dr. Navjot had asked me the case of hypertension in young person or aged person. There are some symptoms in children's also, diseases which does not get result only. In children's, very obstinate: tuberculinum, calcarea carb, antimcrude, chamomilla, and China. Can anybody tell me the obstinate symptom of calcarea carb? And when I tell you why calcarea is obstinate, you will say that how many cases you have missed in your practice and not given calcarea carb, and you have given some other remedies. Can anybody define the obstinacy of calcarea carb in one line? And you'll be surprised that you have seen so many calcarea carb in your clinic, but you have not prescribed because you don't know that was present in calcarea carb. Anybody can tell me the obstinate symptom of calcarea carb? Why a calcarea carb appears or seems to be obstinate? Anybody? Yes, Dr. Weber. calcarea carb इतना obstinate क्यों रहता है? You know, I'll tell you, in case taking, whenever the mother of a child comes and tells you, or the husband and wife are sitting and the mother tells, okay, my child is very obstinate, he does not listen only. And the father immediately, no doctor, he listens. But you have to explain him why and why we want this. And that's why a calcarea carb will be obstinate, and the obstinacy will go when you give reasons why this has happened. If you give reasons to a calcarea carb, the obstinacy will be taken care of. He yields only to reasons. It's such an important symptom. That is calcarea carb. Of course, then people give lecture that calcarea carb is very obstinate and fat children inclined to go. That is there. बट जब भी कैलकेरा कार्ब को समझा दिया जाता कि भाई हम ऐसा क्यों कर रहे, हम बाहर अकेले क्यों जा रहे, आपको क्यों बाहर नहीं ले जा रहे, अगर आपने समझा दिया तो कैलकेरा कार्ब समझ जाएगा. लेकिन आपने उसको नहीं समझाया तो जिद पड़े रहेगा वो. दैट इज द ऑब्स्टिनेंसी ऑफ कैलकेरा कार्ब. I hope I was clear in explaining you the obstinacy of calcarea carb, everybody? That is calcarea carb. I think nobody is telling yes or no. I hope you understood calcarea carb obstinacy. I think not. Okay, nobody is interested. Fine. So we have next question, Dr. Vivekananda. Female 51, widow. 19 years after 3 years of marriage, depending on the sister, right here, hard of hearing, slots in eating, cannot take sour, salt, sour things. Yeah. So Dr. Singh understood, Dr. Desha understood, Dr. Navjot understood. Only 3% understood out of how many? 120 online. See, whenever I'm teaching mathematics, I always try to teach something which basically is so important in a practice, and you miss out that symptom and you then give chamomilla, you give sina, you give tuberculinum, and you say the child बहुत snappish hai, he does not listen and he keeps crying. So we immediately go to chamomilla and sina and china and antim crude, and we miss out calcarea carb. That is the beauty of Medica. Understanding every day. So read it every day. Okay. So one question, I'll just answer that question. Sensation of falling when standing or walking. Now, see, whatever, Mishra ji, समझ गए आप. Thank you. So अभी हम एक question, tendency to falling while standing. Tendency to falling while standing. Now see what happens. Lot of emaciation, and then if you are falling, that's one reason. But whenever the patient has a symptom of tendency to falling while standing, instead of basically going to the symptom, but see which disease the patient is suffering from. Answers I can tell you: think about phosphorus, think about belladonna, and think about zincum metallicum. But my advice to you would be, you first understand why this symptom and then go for the case rather than just giving me symptoms. Okay. So next question, Dr. Ansari says, fear of loss of reason. Now, fear of loss of reason. There are so many remedies, there are so many remedies. In fact, if you have this symptom, you can think about bratas, you can think about calcareas, but my explanation, my answer to would be, if there is a fear of losing reason, that instead of taking that, you take the rubric lack of self-confidence, and that sums up the whole patient in that lack of self-confidence. And whenever there is lack of self-confidence, then you have see lot of remedies. You can start from ambrosia to silicea to phosphoric acid to pulsatilla, natrum. If you take a wide area, no. So in this case, for example, if the patient says, I feel that I'm a failure in life. Okay, I have not done anything in life. I could have done so much, but I could not do. So he is giving you a particular reason for lack of confidence or losing reason. Then you think about remedies like sulfur, naja, aurum sulf. That is important. You have to define that lack of confidence, because lack of confidence, there would be hundreds of remedies. But if you start defining lack of confidence, why that lack of confidence, then the patients give you psoric answers, psychotic answers, and syphilitic answers. This is a syphilitic answer. The patient has so much in life, he has earned so much, but still he feels that I don't have. That means he is very discontent in life. So lack of confidence, you club that with discontentment or dissatisfaction, and the remedy comes out. This is very important. Okay, अपर लाइन देखिए प्लीज. मुझे तो लाइन दिख नहीं रही है, बट हम कोशिश करते हैं देखने के लिए किसका क्वेश्चन है. फिर से एक बार लिख दीजिए मिश्रा जी, क्योंकि हम शायद काफी ऊपर निकल गए वो. तो अभी आप समझिए लैक ऑफ कॉन्फिडेंस हमने डिससैटिस्फैक्शन कैसे ऐड कर दिया. या फिर पेशेंट बोलता है कि मुझे कॉन्फिडेंस नहीं, मेरे बच्चे मेरा ध्यान रखते नहीं, मैंने बच्चों के लिए इतना किया, अब लगता है मैं कुछ नहीं कर पाऊंगा. सो क्लब दैट लैक ऑफ कॉन्फिडेंस विथ डिल्यूजन, नेग्लेक्टेड ही इज, एंड यू गेट द रेमेडी. सो होम्योपैथी एक्चुअली बहुत ईजी है अगर हमने उसको कॉम्प्लिकेट नहीं किए तो. इफ इट इज ईजी, but if we complicate the pathy, you get complicated results. It's a process. Homeopathy practice is a process. Every day you learn, every day you make mistakes, and you learn from the mistake, because nobody is perfect, and nobody can ever be perfect in homeopathy, because it's an evolution. It's basically you have to learn every day. That's important for us. हाँ मिश्रा जी, आप लाइन लिख सकते तो लिखिए, ऊपर तो काफी चले गया है. So I hope you understood the meaning of lack of confidence, no? Sir, she's a widow having this sensation of... Yeah. Oh, fantastic. Sorry, I could not. Now, I think once I had told this implied rubric of sensation of falling, it's very simple. It's very simple, Dr. Vivekananda. That is a widow having sensation of falling. That means a widow has a fear that her esteem would be lost. Whatever esteem she was carrying when she was married, now there is no husband, now she has no support, now her esteem will be lost. That is how we have to interpret that sensation of falling. Esteem. When your husband is there in a particular position, he expires, the position is lost, the widow comes down from life from the 1 to 10 because husband is not there. That fear has the loss of esteem or fear of losing reason, fear of losing the esteem is the same sensation of falling. I think I have explained this implied rubric in my previous YouTube also. हाँ मिश्रा जी, यूरेथ्रा स्ट्रक्चर क्लिमेटिस फेल्ड के बाद एनिलियम दे सेटिस्फैक्शन रिजल्ट नहीं आए. नाउ स्ट्रक्चर ऑफ यूरेथ्रा, अभी हम अगर आप हमसे पूछेंगे कि भाई स्ट्रक्चर के लिए कौन सी दवाई है, तो सबसे पहले कोई भी डॉक्टर आपको क्लिमेटस ही बोलेगा. बट मिश्रा जी इसमें बहुत सारे रेमेडीज है ना. जब भी हम बार बार उसको यूरेथ्रा को डायलेट करते हैं और वो बार बार चिपक जाता है, सो आफ्टर डायलेटेशन अगर आपका यूरेथ्रा चिपक जा रहा है तो उसमें 2 रेमेडी आपको सोचना है. पहला है कोनियम मैक्युलेटम एंड दूसरा है मैग्नीशियम म्यूरो. मैंने आपको पहले बताया था. सिंपल स्ट्रक्चर के लिए दवाई, अगर आप पेशेंट आए स्ट्रक्चर के लिए आपको कुछ समझ में नहीं आ रहा, क्लिमेटिस तो है, बट क्लिमेटिस के ऊपर और एक दवाई है, वो है मक्सॉल. सो आपको ध्यान रखना है मक्सॉल, क्लिमेटिस, कैंथरिस, एसिड फ्लोर और रस्टॉक्स. ये 5 रेमेडीज मैंने बहुत हमारे प्रैक्टिस में मुझे काम में आई है। इसके अलावा कुछ रेयर दवाइयाँ जो मैंने यूज किया प्रैक्टिस में, वो भी लिख लीजिए आप। नक्सोमिका, नाइट्रिक एसिड, पेट्रोलियम, कोनियम मैकुलेटम। सो ये 5 से 8 दवाइयाँ जो बहुत इंपॉर्टेंट है, जो स्ट्रक्चर के लिए काम करती है। अगर आपने पेट्रोलियम यूज नहीं किया है तो पेट्रोलियम यूज करके देखिए। यूरिथल स्ट्रक्चर के अंदर पेट्रोलियम के अंदर बहुत अच्छे रिजल्ट है, पेट्रोलियम, नाइट्रिक एसिड और सल्फर आयोड। आई होप अगली बार आप यूज करके बताएंगे कि रिजल्ट आया कि नहीं। डॉक्टर वैष्णव सेज patient age 32 having infertility with uterine TB change. Oh, Dr. Vaishnav, it's a very chronic case because there is adenomyosis also, TB भी हो गया है। तो इसके अंदर डॉक्टर वैष्णव, it is very important you take the whole case. The whole case is very, very important because tuberculosis is there, and if you are not able to treat this case, it can extend, it can spread, and you have miliary tuberculosis, and it will be a very life-threatening condition. So whenever if you're taking such type of cases in your hand, make sure that you have taken the whole case and you have hit the similimum. Otherwise, tell the patient to take that protocol of tuberculosis in allopathy medicines, and then you can treat him for infertility. Because if that tuberculosis is not taken care of, then you'll be in a lot of trouble and the patient's life is at stake. Okay. So it is it's already 55 minutes. A scope of pituitary adenoma. Yeah, Dr. Ansari, there is a scope of remedy in pituitary. There is a scope of homeopathy in pituitary macroadenoma. I have few cases and they have responded fantastically with treatment. Dr. Vaishnav, yeah. So turbid. Turbid urine, basically what happens? I will tell you some remedies for turbid urine. So turbid urine is also called as cloudy urine. So whenever there is a cloudy urine, you have to think about 3-4 remedies. Dr. Yasin. Sarsaparilla, sepia, हेलोनियस, सॉलिडेगो। ये 4 रेमेडी बहुत इंपॉर्टेंट है। सारसापरिल्ला, सीपिया, हेलोनियस, सॉलिडेगो। CD Watts on left dorsum of elbow joint. Classical, classical remedy only for elbow joint. I think it is. I have not read in my practice. I have not read in my practice कि भाई उसके लिए ऐसी कोई classical remedy हो. But if you have got CD Watt, then you have to think about the first remedy which I would think about would be ranunculus. Ranunculus is very, very important remedy. But if you have seen in your practice, elbow joint के अंदर एक अगर आपको बहुत classical remedy चाहिए, तो 2 remedies are there which I can recall in my now. First is calcarea floor and second is calcarea carb. I think these 2 remedies are there where there is a warts on the bends of elbow. Warts on the bends of elbow. Calcarea floor and calcarea carb. But if it is like seed, then you have to think about remedies like ranunculus. It is with renal cyst. No, then you see, if there are 2-3 diseases, then you have to take the whole case, And sometimes what happens, what is true to the part, Dr. Boning Hussain, what is true to the part is true to the whole. So it will be very surprising for you sometimes that you have taken the whole case and the patient comes out to be calcarea floor, and that calcarea floor matches the whole constitution, matches the renal cyst and the warts also. Such beautiful homeopathy. One symptom and everything will fall in line. So I hope everybody today has enjoyed this YouTube live as I've enjoyed you teaching. So meet you next time on LM Potency on Google Meet. I'll tell you the date and we'll discuss on LM Potency. So whoever wants to join will send the link, and I'll ask my assistants to follow up that Google Meet on LM Potency. Thank you so much for joining.